This podcast is a production of Unfiltered Studios. If you would like to know more about joining Unfiltered Studios, please visit our website at unfpod.com for more information.
Welcome to Hypno Wellness, the podcast that explores the power of hypnosis in promoting mental and physical well-being. I'm your host, Cindy Brainerd, and today we will have an insightful episode that addresses a common fear, going under anesthesia. Going under anesthesia for medical procedures. Specifically, we'll focus on how hypnosis can help alleviate anxiety and enhance the experience. On Tuesday, I will undergo a colonoscopy. Now, it's not general anesthesia, but I have no control over the situation, and I'm a little frightened. I don't think I would be human if I weren't a little concerned, but the fear outweighs not knowing what's going on with my body. I am now fully prepared to do this with the help of hypnosis, breathing techniques, and meditation. So, we're now going to jump into understanding anxiety and anesthesia. Many people experience anxiety when faced with the prospect of undergoing anesthesia for medical procedures. The fear of the unknown, potential complications, and loss of control can be overwhelming. Let's discuss preparing to go under anesthesia and some practical ways to prepare yourself for undergoing anesthesia. Whether you're facing a colonoscopy like I am or any other medical procedure, these tips can help alleviate anxiety and make the experience more comfortable. Educate yourself. One of the most effective ways to reduce anxiety is thorough knowledge and understanding of the procedure. Take the time to research and learn about the procedure you will undergo, including the anesthesia process. Speak with your doctor and healthcare provider to get a clear understanding of what's expected. Speak with your doctor or healthcare provider to get a clear understanding of what to expect. This information can help demystify the procedure and alleviate any fears associated with the unknown. Communicate with your health team. Building a strong relationship with your healthcare team is critical. Before the procedure, take any opportunity to discuss the concerns and fears with your doctor or anesthesiologist. Right now I have a question put in to do I take certain medications or not, so I'm waiting on a call. So hopefully they'll get back to me soon. They are trained professionals who can provide reassurance and any questions that you may have. Open and honest communication allows for them to tailor the anesthesia approach to your specific needs, ensuring you feel comfortable as possible. Practice relaxation techniques. Engaging in relaxation techniques before the procedure can significantly reduce anxiety levels. Deep breathing exercises, meditation, and mindful techniques are accessible tools that can be practiced anywhere. Prior to the procedure, set aside time each day to practice these techniques. By doing so, you will become more adept to calming your mind and relaxing your body, allowing you to enter the procedure in a more composed state. Create a supportive environment. Surrounding yourself with a supportive environment can make a world of difference. Inform your loved ones about the procedure and share your feelings with them. Having their support and encouragement can help alleviate anxiety and provide a sense of emotional comfort. Additionally, consider bringing a familiar item such as a comforting blanket or music to the hospital or clinic. These familiar elements can help create a more calming and soothing atmosphere. Trust in the professionals. It's important to trust in the expertise of the medical professionals who will be overseeing your anesthesia. Anesthesiologists are highly trained and experienced in administering anesthesia and ensuring patient safety. Remember that they are there to take care of you and will monitor your well-being throughout the procedure. Trusting in their skills and expertise can provide a sense of reassurance and help alleviate anxiety. By educating yourself, communicating with your healthcare team, practicing relaxation techniques, creating a supportive environment, and trusting the professionals, you can approach your procedure with confidence and peace of mind. Now that we know how to prepare, let's discuss some of the common fears people may have when facing anesthesia. By understanding and addressing these fears, we can try and help alleviate anxiety and promote a more positive experience. Let's explore some of these fears and ways to address them. Loss of control. One common fear is the feeling of losing control during anesthesia. It's natural to have concerns about being unconscious or relinquishing control to the medical professionals. That's me. However, it's important to remember that anesthesia is administered by highly trained anesthesiologists who prioritize patient safety. They will monitor your vital signs and ensure that you are in a controlled and safe environment throughout the procedure. Trusting in their expertise and understand can help alleviate these fears. Another fear is worrying about waking up during the procedure. Although this is an extremely rare occurrence, it can be a source of anxiety for some individuals. To address this fear, it's important to communicate openly with your healthcare team. Share your concerns with your anesthesiologist before the procedure so they can address them and provide reassurance, and also discuss your medications thoroughly with them also. They will monitor your levels of consciousness closely and adjust the anesthesia dose accordingly to ensure you remain comfortably asleep throughout your procedure. The fear of potential side effects and complications associated with anesthesia is understandable. However, it's important to remember that anesthesia is a well-established medical practice with a low risk of adverse effects. Your medical team will thoroughly assess your medical history, allergies, and any potential risk before administering anesthesia. They will also discuss potential side effects and address any concerns that you may have. Trusting in their expertise and following their instructions may help alleviate this fear. Many individuals experience that post-anesthesia nausea and vomiting. While these side effects can occur, there are effective measures to prevent and manage them. Your anesthesiologist will take steps to minimize the likeliness of these symptoms, such as administering anti-nausea medications or adjusting the anesthesia technique. It's important to communicate any history of motion sickness or previous experiences with nausea to your healthcare team so that they can tailor the approach to your specific needs. Allergic reactions to anesthesia are rare, but they can be a concern for some individuals. To address this fear, it's crucial to provide your healthcare team with a comprehensive medical history, including any known allergies or previous reactions to the medication. This information will enable them to select the most appropriate anesthesia medications and take necessary precautions to minimize the risk of an allergic reaction. Rest assured that your medical care team is trained to handle potential allergic reactions and have emergency measures in place if needed. We've discussed some of the common fears related to anesthesia and provided ways to address them. By communicating with your healthcare team, understanding the safety measures in place, and trusting in their expertise, you can overcome these fears and approach your procedure with greater confidence and peace of mind. So let's talk a little bit about putting off a procedure due to fear. While it's natural to have concerns about fears with anesthesia, it's essential to consider the potential consequences of delaying or avoiding a necessary procedure. Many medical conditions and symptoms can worsen over time, leading to increasing discomfort, complications, and even potentially life-threatening situations. By postponing a procedure, you may inadvertently allow the underlying condition to progress, causing more harm in the long run. To make an informed decision, consult with your healthcare provider. They will consider your individual circumstances, medical history, and urgency of this procedure to guide you into understanding the risk versus the consequences of postponing. Your healthcare provider will provide you with the necessary information to assess the situation and make the most appropriate decision for your health. Weighing the benefits. It's essential to consider the potential benefits of the procedure as well. Discuss with your healthcare provider the expected outcomes, improvement in your health, and the potential to alleviate symptoms to further prevent complications. By understanding the potential benefits, you can better alleviate the value of proceeding with the procedure. If anxiety and fears related to anesthesia are a significant factor in your decision-making process, consider discussing this with your healthcare provider. They may be able to offer additional support, resources, or even alternative approaches to help manage anxiety, such as a pre-procedure counseling, relaxation techniques, even medication. Remember that your healthcare team is there to address your concerns and support you throughout the process. Some people coming in for a dental procedure, even for cleaning, have to take some type of anxiety medication, and that's okay as long as they're getting things done. We've explored the importance of weighing the risk of undergoing a procedure with anesthesia against the potential consequences of putting it off. By understanding the risk, consulting with your healthcare provider, considering the benefits, and addressing anxiety and fears, you can make an informed decision that prioritizes your overall well-being. Remember, the ultimate goal is to ensure your health and improve your quality of life. So, you've fully prepared and know what to expect and understand the dire risk of putting things off, but are still apprehensive. Fear not, because hypnosis offers a solution. Let's explore the benefits of hypnosis for anxiety management. Hypnosis is a state of deep relaxation and heightened focus that allows individuals to tap into their subconscious mind. During hypnosis, a skilled hypnotherapist can guide you through positive suggestions and imagery, helping to reframe negative thoughts and emotions associated with anesthesia. By accessing the subconscious mind, hypnosis empowers individuals to develop a more positive and resilient mindset. Through hypnosis, you can work on reprogramming your mind to view anesthesia as a safe and beneficial experience. The hypnotherapist can help you identify and address specific concerns that you may have. By replacing negative thoughts and emotions with positive and reassuring suggestions, hypnosis can create new neural pathways and support a more relaxed and confident mindset. It is important to note that hypnosis sessions are tailored to the individual's unique needs and concerns. A skilled hypnotherapist will take time to understand your specific anxieties related to anesthesia and customize the hypnosis session accordingly. This personalized approach ensures the session addresses your fears directly, maximizing the effectiveness of hypnosis in managing anxiety. Hypnosis can also help you develop coping strategies to use before and during the anesthesia process. These strategies may include deep breathing exercises, visualization techniques, or self-calming anchors that you can utilize to stay relaxed and focused. By practicing these techniques during hypnosis, they become ingrained in your subconscious, making them even more accessible and effective when needed. When anxiety is effectively managed through hypnosis, the anesthesia experience can become more positive and comfortable. By promoting relaxation, reducing stress, and instilling a more sense of control, hypnosis contributes to an overall smoother and more enjoyable procedure. It allows you to approach anesthesia with greater confidence, knowing that you have the tools to navigate any anxiety that may arise. We've just about reached the end of this episode of Hypno Wellness, where we have explored how hypnosis can help manage anxiety associated with anesthesia. We've discussed the benefits of hypnosis in reframing perceptions, empowering individuals, and promoting a more positive experience during medical procedures. We began by acknowledging the common fears and anxieties people may have when facing anesthesia. When we discuss practical ways to prepare for anesthesia without hypnosis, such as educating ourselves, communicating with healthcare professionals, practicing relaxation techniques, creating a supportive environment, and trusting in the expertise of the medical team. We also addressed specific fears related to anesthesia and offered strategies to alleviate them, including the fear of the loss of control, waking up during the procedure, side effects and complications, post-anesthesia nausea and vomiting, and allergic reactions. Understanding and addressing these fears can help individuals approach anesthesia with greater confidence and peace of mind. We explored the importance of weighing the risk of undergoing a procedure with anesthesia against the potential consequences of delaying or avoiding it. It's essential to consult with healthcare providers, understanding the benefits of the procedure, and consider the potential impact of postponing it on one's health. We've delved into the power of hypnosis in managing anxiety associated with anesthesia. Through deep relaxation and positive suggestions, hypnosis can help reframe negative thoughts and emotions, building coping strategies, and empower individuals to approach anesthesia with a more positive mindset. I even provided a hypnosis session to support the process of managing anxiety, which will come out on Thursday. Remember, whether you choose to utilize hypnosis or not, it is crucial to prioritize your well-being and seek support from healthcare professionals when needed. Your healthcare team is there to guide you, address your concerns, and ensure your safety and comfort throughout the anesthesia process. I hope you've gained valuable insight into managing anxiety associated with anesthesia. Today is my prep day, so this gives me something to do other than having clear liquids and think about my actual prep in a few hours, if you know what I mean. Now, remember to take care of your mind and body and stay tuned for more episodes where we explore techniques and strategies for enhancing well-being and promoting a more harmonious life. Don't forget the bonus episode tomorrow on how to manage anxiety and anesthesia. Thanks for listening to this episode of Hypno Wellness. If you enjoyed this episode, be sure to subscribe to the Hypno Wellness Podcast and leave us a review. And as always, if you have any questions or comments, feel free to reach out to me on Instagram and YouTube.